Hello everyone, I'm Dr. Kevin Halow, co-founder and chief medical officer of ClinicianCore. Over the past several weeks, we've opened early access to HCO Practice HQ, our healthcare organization platform. We invited physicians to explore what we're building and to share their feedback. What happened next exceeded our expectations. So we thought physicians would be the primary voices in these conversations. However, there were a lot more. More than 100 clinicians from across the healthcare ecosystem joined us. Physicians, advanced practice providers, nurses, administrators, and healthcare leaders representing a wide range of specialties, organizations, and care settings. Now, some were excited, some were skeptical, some challenged our assumptions. Others shared stories about communication breakdowns they experience every single day. And that is exactly what we hope for, because the HCO section of ClinicianCore wasn't built in a boardroom, wasn't created for market research reports or technology trends. It was built from real frustrations that healthcare professionals experience every day. Fragmented communication, endless notifications, delayed responses, uncertainty around who's covering, communication silos between teams, and the growing administrative burden that pulls clinicians away from patient care. What stood out most during these conversations wasn't where people disagreed. It was where they agreed. Regardless of specialty, organization size, or role, we kept hearing the same thing. Healthcare communication is far more complicated, fragmented, and exhausting than it should be. That feedback reinforced something we believed from the beginning. Communication isn't a physician problem. It's not a nursing problem. It's not an administrative problem. It's a healthcare problem. And solving it requires a platform designed specifically for the realities of healthcare. So today, I want to share some of the most common questions and feedbacks that we received during the HCO soft launch, and how those conversations are helping shape what HCO becomes as we continue building the communication infrastructure healthcare has always deserved. Let's dive in. Okay, let's look at our first question. Do we really need another communication platform? Okay, this was by far the most common question that we've heard. Healthcare professionals already use phones, pagers, EHR messaging, secure texting applications, email, Teams, Zooms, and countless other systems. So why build another platform? Because the problem isn't that healthcare lacks communication tools. The problem is that communication is fragmented across too many tools. Every additional platform creates another inbox, another notification stream, another place where critical information can be delayed, overlooked, or lost. Our HCO section is not trying to become one more communication channel. Our goal is to become the communication foundation that brings those interactions together into one secure, intelligent environment built specifically for healthcare. All right, let's look at our second question. I use WhatsApp. It's okay. Works for what I need. Why would I switch? Good question. Okay, well, we've heard this often, and honestly, I understand why. WhatsApp is convenient, but so is texting. How many times do you text your colleagues or nurse or tech, right? With information that you probably shouldn't be sharing because it's not HIPAA compliant. See, consumer apps are familiar and easy to use. And healthcare communication is fundamentally different from everyday communication. Healthcare requires a lot of stuff. Auditability, administrative oversight, role-based access, escalation of workflows, coverage management, organizational governance, HIPAA compliance, and complete privacy and encryption. Consumer messaging applications were never designed for those realities. ClinicianCore's HCO is designed for all of that and much more. The goal is not just to prove convenience, but to provide convenience that's also secure and accountable. Organizational intelligence in healthcare requires it. Now, I want to share some feedback we've also received because it's also important to hear what people are saying about the app. So the first feedback we received is this. I love hearing voice, video, messaging, and files in one place. The ClinicianCore HCO does just that. This was one of the most encouraging comments we have received. Many clinicians told us that they're tired of constantly switching between applications throughout the day because switching causes friction, which leads to burnout. And we know how high physician burnout is. What, almost 50% now? Now they don't have to switch. At ClinicianCore, our vision is simple. One platform for all your communication needs. It's the only platform you will need. Let's look at another feedback that we received. The on-call routing capabilities are incredibly valuable. This is a feedback that we've heard repeatedly. Many organizational structures still rely on manual processes to determine who's on call, who's covering, and who should receive urgent communications. Those manual handoffs create delays and confusion. Sometimes they create patient care risks. Our HCO helps automate those workflows so communication can follow the organization's operational structure in real time. The result is faster response times, fewer communication gaps, and greater confidence that urgent information reaches the right person. Okay, I want to switch gears again, and let's take a look at some more questions here from some of our users. So the next question is this: won't smart routing cause me to miss something important? In healthcare, missing critical information is not an option. So the direct answer to this question is no. Smart routing is not about hiding information. It's about delivering information intelligently. The right message still gets delivered. The difference is that it reaches the appropriate person based on responsibility, role, urgency, availability, and organizational rules. The objective isn't reducing visibility. The objective is reducing unnecessary noise while maintaining accountability and responsiveness. Okay, so here's another question. How does HCO actually help reduce burnout? Physician burnout is a serious issue. At this point in time, approximately 50% of physicians have had at least some sense of burnout within the last year. And I want to be very clear, there's no software platform alone that can solve physician burnout because the causes of burnout are complex and deeply rooted throughout healthcare. However, we now know that communication overload absolutely contributes to the problem. Every unnecessary alert, every duplicate notification, every interruption during patient care, every message routed to the wrong person, every delay caused by uncertainty around coverage. Those small moments accumulate throughout the day. Our HCO is designed to reduce communication friction. It does so not by creating more notifications, but by helping ensure clinicians receive the right information at the right time from the right people. Less noise, more clarity, less disruption, less burnout, more focus on the patients. Okay, last question. Can smaller practices benefit from HCO? The short answer is absolutely. Communication challenges are not exclusive to large healthcare systems. In fact, many small practices operate with fewer administrative resources and leaner teams. When communication breaks down in a small practice, the impact can be felt immediately. Whether you're a 3-provider clinic, a specialty group, a growing outpatient network, or a large healthcare organization, effective communication remains essential. HCO is designed to scale with the organization, not force organizations to scale around the platform. All right, well, that's all the time we have for today. I would like to take a moment to thank every clinician who participated in our HCO soft launch. Thank you. Your questions challenged us, your skepticism sharpened us, your feedback is shaping what this platform becomes before our true go live, which is in September 2026. It's coming soon. More than 100 clinicians gave us their time and honesty during this process, and what they reinforced is something we believed from the very beginning. Healthcare communication deserves to be secure, it deserves to be intelligent, and it deserves to be designed specifically for healthcare. That's what HCO is. That is what we're building, and we're grateful to have you with us on this journey. If you're an independent group practice ready to stop losing 45 minutes a day to alert noise and fragmented communication, the HCO soft launch is open now. Early access is limited and closes before the full September 2026 release. Visit our website at ClinicianCore.com, join us, sign up, help us get this right, and let's build the communication infrastructure healthcare's always deserved. I'm Dr. Kevin Halow, co-founder and chief medical officer of ClinicianCore. Thanks for listening.